Welcome to Push Yourself Podcast, the space where we explore real stories of growth, resilience, and the career journeys that shape people's lives. Today's conversation is one I'm especially excited about because we're diving deep into creative arts therapy, mental health, and leadership, and how creativity can help people heal and grow. But before we dive in, I want to share something personal about this episode and why it means a lot to me. Carlos has actually been one of the main catalysts for this podcast, even if he doesn't realize it. Back when I was working as a talent acquisition manager, I had the privilege of recruiting for Carlos for several creative art therapist positions. And I remember thinking, this is a fascinating field that not many people know about. I kept asking myself questions, who becomes a creative art therapist? Is it someone who wanted to be a musician, an artist, and then found their way into therapy? How does someone even get into this field? And that curiosity never left me. In fact, it's one of the main reasons why I started this podcast, to explore these types of questions and share the real stories with you. So today, not only do I get to share it with anyone listening who might be thinking about mental health, creative careers, or just finding their path. Now, if you don't know Carlos, let me give you a quick intro. Carlos Rodriguez Perez is an executive director at Kingsborough Psychiatric Center, a licensed creative art therapist and a board-certified trainer. He has decades of experience working both as a therapist and a leader in the mental health space. Carlos, thank you so much for joining me today.
My pleasure. So glad to be here.
Let's set things up for listeners who may not be familiar with creative art therapy. How would you describe it in a simple way possible, maybe without using words such as therapy, counseling? What does it mean to you?
The creative art therapy is the intentional use of the arts for the purpose of improving symptoms due to afflictions and disease. So in this sense, the agreement with our clients is that we want to improve their health by using our interventions. And those interventions should be specifically designed to help with the goals that were agreed upon when someone engaged with a creative art therapist.
So what is it about creative expression, whether it's through music, movement, drama, visual arts, that helps people process emotions differently than traditional talk therapy?
That is a great question. First of all, the arts all by itself are healing and organizing. You can go to a concert and have quite an experience that could be pretty transformative. You can go to see a play, a movie, read a book, and in that sense, that art manifestation can provide you with a therapeutic effect. When you think about rituals across cultures and countries, you're always going to find that it's attached to some sort of art manifestation, dance, music, art, writing, singing, that is connected to that. So that already happens. So for that, most of us don't need to engage a creative arts therapist or a therapist at all. The arts does that in itself. What is different from traditional psychotherapy, in which you're sort of talking through with a therapist, is that in the creative arts therapies, we're going to engage the creative process for two reasons. One is to approach the issue in a different manner, engage a total different part of our brain that may access information in a way that simply talking about it may not be sufficient. And at times also, talking about our experiences can be harder. So by using the arts, we can create space and distance. It's safer to explore those events and those memories and those issues. So that is why creative art therapy sort of come into the therapeutic spaces to provide an alternative to traditional, what we call, psychotherapy, verbal therapy.
Thank you for explaining that. And is there an example you would love to give to someone that may be potentially interested in this field? What are some of the patients that come to you as a creative art therapist and individual staff that you manage? What challenges they face and they find creative art therapy to be the proper modality? Can you give an example of that?
Absolutely. First of all, it's important to know that creative art therapists are working in all sorts of settings: psychiatric units, schools, private practice, in the coaching environments. So a creative art therapy has the capacity to engage with people in different settings and also of all sorts of ages. So like any other therapeutic approach, people are going to have expertise working with youth, perhaps working with the, geriatric patients in that sense. For example, when we think about people that are working in geriatric settings, they may be working on memory recollection, but also sustaining memory. And they can be using storytelling as a means for recollection and sort of keeping that brain remembering and exercising that. And storytelling is a great way of doing a fun activity of sort of tell me about a time when, and sort of accessing that memory in a different way. And also keeping, again, for an elderly person, we want, that is aging, we're trying to slow down and ameliorate perhaps dementia processes. So we can introduce those techniques in that way. Storytelling may incorporate, the retelling of the story that can be recorded and use, a playback to the patient. There could be writing involved. There could be images involved, and other tools in that way that you sort of create a narrative that anchors the memory, so that person can come back to it in that sense. So that's on one extreme where we're literally working with cognition. Dance movement therapists are particularly, skillful in assisting people with brain injury and dementia processes because movement is stored very differently in the brain. So someone that may have a hard time walking may be quite good at dancing because, again, it's a very different wiring in the brain. So you can keep someone physically active by engaging in a different activity rather than the traditional way of approaching the work. So those are, some examples in terms of creative art therapies working with the same population in a very different way to keep someone healthy.
It's very, very interesting movement process, definitely by the brain. That's very interesting. It gets me thinking about memories and how certain sights, certain things we see, things we hear can recall memories. So I think this is what probably somebody who's removed from creative art therapy, not familiar, might not realize the advantage of such an additional modality that has such a potential and does uncover additional things about us as individuals.
And there are two people to look at, that are not creative art therapists, but are right at the intersection with creative art therapists. One was Oliver Sacks, his work with Tommy Tomino, music therapies, and the development of the Music and Neurology Institute. Right there, we're talking about brain disease and music, so a neurologist and a music therapist. And the other hand, Job Hopkins studying the intersection of the arts and the brain as well as a means to devise medical strategies around that. And you have very famous people involved on that work. So it's a very exciting time as it relates to brain and the arts. Of course, the technology is allowing us to see, in much better detail that impact in which we didn't used to have.
I would love to follow up on that. Anything that you're doing specifically right now, and maybe specific to technologies, the new technologies that you may be using, what's the exciting things about the field of creative art therapy right now?
One of the things creative art therapists are exploring is the intersection of technology in that sense. So, for example, there is a art therapists that have been using green screen technology with youth, with young people to work. So not only they're working on the narrative and the fantasy of the storytelling, they're using all this video technology with green screen to literally create a movie about that narrative. So it's amazing, so accessing that. So in that way, sort of, taking in my time would be drawing, maybe dressing up for the character. Here is a art therapist engaging this technology, and it's a way to bring in young people to do amazing work in a way that they feel compelled, engaged, meeting them where they are with technology. So that's just one example in that regard. I can tell you, for example, during the pandemic, we sort of created like a playlist for clients that were intubated specifically to assist them through that process when they were in a medical-induced coma, to have music to soothe them through that process, knowing that although they were unconscious, the brain was still there in that sense. So those are, just examples of some of the work that creative art therapists have engaging technology. There's a lot more happening within that regard. But, people, particularly as technology have become much more accessible and affordable.
It's very, very interesting. I had this thought. A couple of weeks ago, I was talking to someone, and there was a mention of an artist, I believe a painter. The name, I apologize, escapes me. However, this individual unfortunately ended up committing suicide. But this individual who I was speaking with mentioned that viewing kind of the whole scope of this individual's work, they could, in retrospect, see how maybe colors changed. And in a way, to hypothesize, hindsight is 2020. You can see now how this individuals might have felt mentally. But if I were to look at this individual's art, you can tell that the colors got darker. They went into a certain direction that by someone who is familiar with this modality, somebody who recognized the patterns, who's been trained, can certainly spot, these kind of things and maybe potentially prevent this unfortunate end that a lot of individuals go through, life unable to express themselves. And I would certainly see, as you mentioned, working with the youth, someone who's just growing up, young men and women, making sense of this world. They might not have a big enough vocabulary to express their feelings, and I can certainly see how creative art therapy, whatever modality might be appropriate, would be that catalyst, that funnel, that proper way to get those feelings out. What are your thoughts?
So now we're moving to the assessment part of the clinicians. So there've been some developments. This is particularly better developed or more better known with art therapists. And it makes sense because art therapists have gone to study the artwork of previous artists and sort of being able to hypothesize about their mental health based on their art production. That being said, the assessment that creative art therapists do can point out risky or problematic issues presented by a person. So, for example, art therapists will be able to tell you the repetitive certain imagery that is presented on the artwork production may indicate aggression, repression, and concerns that may lead to further exploration. In certain settings, the art production is used as a means for screening and start understanding there's too much of this or too little of that. Let's now do a more in-depth piece of work, a assessment into what may be happening with that person. It also assists us in the understanding of progress. So, for example, in drama therapy, so we work particularly in a role method or role theory a methodology, we are looking for an expansion of the role repertoire. So we believe that when someone is very ill, the role repertoire is very limited. And we want, and part of the aim of the therapeutic sessions is to expand the possibilities that are supposed to be very limited to a few roles, or those roles be very constricted to give people more ways of being and existing in that space. So we measure health not only by this, the role, the choices someone in terms of roles, but also the ability to move from one role to another, depending on the circumstances and as they need to. A healthy person will do this with not thinking. The way I am with my employees and the way I am with you, when I am with my friends is different. So we're constantly adjusting how we present ourselves unconsciously. So as a drama therapy, we're looking to help people that perhaps are not as struggling with that and are presented very rigidly or in a very limited way. So that's one way to think about that. And dance movement therapies are going to be looking at range of motion. how your body presents, what are the possibilities in terms of how your body moves in the space or doesn't move in a space, how does it move in different spaces as well, and also the experience of the body in different spaces and different circumstances. So similarly, all the creative art therapies have ways into using the art expression as an assessment tool. That give us, first of all, some warning, but also some notion of whether someone is getting better or not, other than symptom reduction in that sense. There's a whole other field of being able to use this tool also to assess a neurocognition and neurodeficits. That's a much more complex thing. And it's not something that we creative art therapists are heavily trained on, but we can start pointing out in some rudimentary ways when someone may be presenting and referred to neurologists or a psychologist or an occupational therapist, someone that appears to be struggling with in some fashion, and again, as a screening for further assessment. I hope that makes sense.
Wow. No, it certainly makes sense. And I have to tell you, like, when you began talking about drama therapy, question popped up that you actually answered. If I'm understanding you correctly, if an individual is able to switch between these roles as we do in society, in our life every single day, they could be a positive sign. But if they're not, I guess that would mean they're too much. Something's happening there that's preventing them from adjusting, and that will be a sign of illness. And you gave me so much information. Well, I appreciate that. Like, I feel like I'm learning so much already, and our audience as well. But I'm curious, something that I couldn't help but think. Again, I'm from my perspective, majority of population think about talk therapy, but I would wonder, what is the intersection? What is the cooperation like you have between like regular, what we consider talk therapists, and working with creative type therapists? Is there a point where regular talk therapists would have been trained to spot like, oh, I'm not getting results from this patient. Maybe it's proper to get involved with a creative art therapist? Because I can't help to think there would be these kind of instances, someone who comes straight to talk therapy.
So in certain settings, that is the way it is set up. So when we think about inpatient settings, and the more complex the presentation someone has, the more professionals are going to be involved, because it's just a complex case, assume different needs, and there's not a single professional that can meet all the needs of someone. This is not different when you think that of medicine. When you go to your internist, to your general doctor, you go for your annual checkup, and if there's something going on, he refers you to a specialist. Go and talk to the podiatrist, to the dermatologist, and then come back and tell me what I tell you. So in that sense, you could be, a client can be working with a psychiatrist, and the psychiatrist is primarily perhaps working on diagnosis and pharmacological treatment, but then it may suggest to their colleagues, whether it is the social worker, the psychologist, the mental health counselor, and the creative arts therapist, here is what's going on with Carlos. How can we help him to, achieve this, improve his health, achieve these goals? And then depending on the needs, we refer them to the different specialists. So within psychiatric units and even some nursing facilities and in clinics, you're going to have an interdisciplinary or multidisciplinary team that is working with the client in different ways. And this is the understanding that, there may be information that is elicited in a session that informs the next one and creates a loop of information to provide that. The other important thing to keep in mind is that while some people do very well with traditional creative art therapy, some people don't. And this is where creative art therapists can provide an alternative. That doesn't mean also that creative art therapy is also not for everybody neither. Some people really are going to be working more traditional methods and ways. The other piece that creative arts therapists are usually very, very strong is doing group sessions. We are very good and very well trained group therapists. And while there's a lot of value for individual therapy, there's certain skills and experiences that are best delivered in a group context. And the group provides an opportunity for clients to feel seen by other people and recognize each other in a way like, I'm not the only one struggling with this. And here's other people that are also struggling and learning from each other. And that is not going to happen in an individual session because you are just there with your therapist. So that's the other piece that creative arts therapists are very good in providing a group experiences through the arts where allow the participants to learn from each other, but also to really normalize the experience that they're not struggling with this all by themselves, that there are other people. And in that way, there's this beautiful opportunity for support and learning within that group context.
I love that. I love that. It seems to be coming up very frequently in my conversations with various individuals, but I love this concept of being vulnerable. And I think group therapy provides an environment for that. You know, I often say like social media has a lot of its negatives. We put ourselves out there the best picture, the best side, but I think it's important to show vulnerability, to show that not everything may be going okay in life, to show that, hey, sometimes, they're up, sometimes they're down, moments when you could use help. And I love that kind of, if this platform could be a way to showcase that or a pathway to help people struggling, this is just to underscore the importance of sharing the times that we struggle so that by extension, we may be helping somebody else to realize, hey, I don't feel good. I feel down. I feel depressed. But then somebody sees it. I'm not alone. And maybe that will be a catalyst, not just to get into your head to think, oh, I'm the only one experiencing this, but a push to get help. Like, oh, I see other people struggling with the same thing that I do, whether it's depression, suicidal ideation, whatever that may be. I don't know why I'm feeling this way, but I see somebody else, went the same path and they got better. So I think it's very important. I appreciate that reminded me of push that message of sharing for kind of a collective experience that we often hide.
And you mentioned something really essential, which is hope, is to learn like, look, someone went through this and there they are, and think about the message that we send to young people. It will get better. And when you're young, you don't know. And when you're alone, you don't know. So a lot of the social media campaign, which for youth that may be depressed and considering suicide, is like, wait, this feeling will change. Things will get better. You have simple messaging of creating hope. And this is where social media can and should play and does play an important role for people that are isolated. So yes, there's a lot of challenges with social media, but at the same time, for people that are isolated, it can create an enormous sense of hope by witnessing other people that have similar experiences. They may be far away, but here we are, in that sense. So there is an opportunity to activate this, and this is what this work that you're doing is important. One person needs to hear this, and their life will be changed, and then that's enough.
I totally agree. Yes, if at least one person would hear this and they would be kind of turned into the direction of help, that would have been well worth it. Yes. And at the same time, I think about this, I grew up having to learn internet like in my early teens, but I'm thinking now my son who turned 12 recently, he's growing up in this environment. And I know I can't shield him. I can't put him in a cocoon of not social media, but I have to be there along the way, guiding him, but also kind of supporting him. I can't hide it forever. It's better for me to introduce how to properly navigate this world of such hyper interconnectedness, but also teach him the tools along the way that whatever you see there, the message you get isn't necessarily how you should be processing it internally. So I think the message you're putting forth is very, very important, that we're adjusting and we're navigating. But, as anything in life, anything can be positive and negative. It depends how we use it. But I would love to ask, before we delve into your past, having the opportunity to observe your interviews, I was able to see that interplay of how you lead your team. And that really struck a chord with me in the sense, oh, I sense something that I can't quite put a finger on right now, but I know it's different. I felt a lot of warmth in the way that you facilitated that interview experience. I know it's a little bit different than in a clinical setting, but I felt such a positive report from everyone involved on your team. And I would love to know, how does your clinical background influence the way that you lead your teams today?
I think the first thing, we creative art therapists are problem solvers. So we tend to step into roles of leadership one way or another. We're leaders of group sessions, we are teachers. So we're really well suited to step into these roles. As a drama therapist, one of our roles is to be the director of performances, of plays, and when you think about, for those of us that have actually worked in theater, a production, what a lot of moving pieces that want me to be thinking from the cast, the libretto, the rehearsals, the time, the costume, the lighting, the props, how, who's going to be in the audience, how many. So it's very natural for us to step into these places because we have skill sets that is very translatable into that. So that's one piece. The other thing is that we have the ability to problem solve and to think about how we can take this and move it forward, and to figure it out. We think, of course, the limitations of regulations and things like that. So I'm not unique that way. When you met me at Kings County, all the directors of the same departments, group therapy departments in every hospital, health and hospital, was a creative art therapist. So naturally we listen to that. But today, you now have people in executive roles in central office that are creative art therapists. The person running finance for behavioral health at Kings County is a creative art therapist. So we're stepping into this role like any other professional. When you think about it, in healthcare services, naturally someone rises to roles of leadership. The role of the clinical leader is important because we bring in that experience, because we also need to be bridging policy, laws, and regulations with the actual care of our clients. So that experience is invaluable. So again, we're just one of the people that are stepping up into these roles. But more recently, there are some theories in terms of how, when we think about people, leaders in the world of organizations and even countries that are entertainers, and they're coming from these spaces of creativity in that engagement. So think of where else this is happening. Something that I will encourage people to look at is a regenerative economy. It's a theory of economy which is looking at how our economy could mimic nature in that sense, in how where there's more in the spaces where nature is the richer, where there's more biodiversity, is actually those very those places where the land and the sea intersects. So, and often at the edges of society, who's there but the artist, And so we're good bridgers in bringing different things and creating something out of those messy spaces. So that's sort of the best way I can be talking into. The reality is, to be very honest, I've always been come upon stepping into roles of leadership in that sense. And the other piece is a sense of curiosity of what are the possibilities. If I step into this role, what are the possibilities I can create for other people to follow? So people did that for me. I didn't get here all by myself. People opened doors for me. People gave me opportunities, extended a hand and pulled me up. So when you roles of leadership, you can do that for other people. And finally, one, I have to approach this with a great sense of humility. At the end of the day, I am a creative art therapist in this role. I'm not a psychiatrist. I'm not a nurse. There's a lot I don't know. So I need to rely on my colleagues and the team I build and put together uh, to join me into this work.
I love that. You made me think of a few things. And first, I thought, you mentioned kind of like a creative art therapist having to manage a lot of things. And I thought of an experience recently when my son went to a new school and we were invited to a birthday party. And, I would describe myself, yeah, probably more introverted. I hang back, but once you get me to on a certain topic, especially kind of like here, I can talk your ear off, but otherwise naturally I will kind of hang back. But then there was one of the parents, who kind of took charge of that whole situation. And then we got to talking, like, what do you do? I'm like, I'm a teacher. I'm like, oh, well, now I kind of see the connection. You can lead, you can take charge, but you have to take charge of groups. And thinking, if you're teaching kids, small kids, that's a lot of coordinating chaos. It's like, oh, I can see, like, now it's kind of things are piecing. Teachers, they have a lot of skills, and or being a teacher, it's a skill that's applicable to a lot of areas, especially when a lot of people interplay is involved. So I love that. And curiosity, yes. Like, personally, like, in a lot of areas for me, curiosity has been a plus. Like, I love to ask questions, especially kind of if I begin a new position. I feel like I'm going to ask a lot of questions. I want to ask a lot of questions because I know I have lived by that motto: everything you learn from somebody else. If you talk to someone, or if you read something, if you watch a video, there's many areas, modalities for you to learn. So, that's another saying: the only stupid question is the one you don't ask. So I'm like, I'm quite the opposite. I feel like I will get to annoy people with questions, because I feel like I need to learn, and that's my natural kind of a MO. I am curious, was there a moment when you realized this is exactly what I'm meant to do? Or did your path to where you are now took a few unexpected turns along the way?
I think it's both. My path has taken some very unexpected ways. I thought I'd be a teacher, and I thought I'd be working with very young people. In fact, when I was studying in Puerto Rico, I was setting myself up to be a teacher for special ed preschoolers. I knew I love kids, and I knew I love kids with disabilities. And and then by the time I left Puerto Rico, I was a licensed teacher, and then come to the U.S., decided to do my master's, and that's how I come to study drama therapy. We moved to New York. I very, found a little bit by accident this thing called drama therapy. And at this time, I was doing a double major. I was studying theater. I wasn't planning to be an actor, but I loved performing. So in I applied very last minute, and they accepted me, and I had a month to move to New York, and I moved. And I figured, well, worst scenario is just not gonna work, and I go back. And so I landed in the most beautiful class at NYU. So doing the work, and new to this country. If you think I have an accent, imagine 34 years ago. And it's a struggling with the English, but I landed in the most gorgeous space, holding space. And one of those moments that, you realize, like, okay, this is the moment, because, a different class had not been so kind. And then in looking for my second internship at Brown Psychiatric Center, they offered me a job, and I'm here, I'm very poor, and I'm like, oh my God, I can't get paid for my internship. And so I wasn't planning to have a career in psychiatry. And then I landed there. Turned out to be one of the few, the only place at the time that had a full team of creative arts therapists. So there were music therapists, art therapy, dance movement therapists, and I was the drama therapist. So not only I end up with some phenomenal people that were at the top of their game, I was expected to do drama therapy. So next thing, I was there for 15 years before I went to Kings County. So no, it wasn't what I was expecting, but it kept revealing itself in ways that I was like, oh my God, this is where I belong. And so, in a way, I have stopped forecasting life. Life had not been anything I planned it to be, but it's been amazing. So,
I've heard an idea that we may think of it as us finding our passions as we try to through life early in life, education, whichever way, kind of the purpose of human existence. You have to find your purpose, find your passion. But I also have heard it to be phrased, your passion will find you eventually, but you have to kind of make an effort to meet it halfway. And this is what I would hope to share, the stories of how you come to that. As you mentioned, internship, various opportunities, and maybe it's that synchronicity. What if you stayed in Puerto Rico, you would not have found this calling, but you came here, and that kind of that branch of life decisions went in different directions. Life is unpredictable in that sense. You never quite know. But when you mentioned things kept popping up, I found, okay, life potentially, it seems to have been giving you signs. But was there ever a moment, a point when you realized the importance of mental health yourself personally and creative expression? Because having experience interviewing, talent acquisition, I've interviewed a lot of people, and through these conversations, I've learned what a lot of people tend to come to certain things that they want to do in work from personal beginnings. So was there an intersection for you, a personal story? Maybe it was a struggle, whatever that was, and the intersection of the work that you were on the way to becoming or doing at the moment.
yeah, look, I was a young person growing up in Puerto Rico. I was a very shy, believe it or not, and I have allergies and asthma. Anyhow, I had to survive being bullied in school, and so I ended up, having to go to therapy, uh, and I not being hyperbolic when I say that the art saved me, because it was those art spaces with the art room in elementary school that became an art teacher that took me under her wing. Really, the teachers protecting me and creating spaces for me to exist and making me feel, to be able to create in that sense. In junior high, going to the music school, knowing that I will never amount to be a musician, but having a place where I was, again, welcome. I was just one another weird kid learning an instrument. Some of them being amazing, some of us being horrendous at it, but it was a safe place for me to exist. And to do that kind of work, and then ended up in high school discovering theater and changing my life forever. I'm like this shy kid. Next thing is on stage on a play in front of all my classmates, and for a moment I discovered like, I can do this if I'm not just me. If it's a role, if it's a character, they're not laughing at me; they're laughing with me now. And growing up, somehow a message came to me about, like, you need to survive high school. When you go to college, it'll be different. And then it was. I met new people and I reinvented myself. And that little kid, no one in college have ever met him because they was not there anymore. So yes, it's being a personal growth where the arts has sustained me through these stages until I was ready and prepared. So yes, the universe sort of very complicitly gave me the spaces, but I had to access them and take them, activate them. So in a way, I had to work at it. It wasn't like just something that dropped on my lap. Lots of people came on the way, to guide me, to hold me, and to protect me. And that is unbelievable in itself.
Any particular mentors or if parental influence kind of made you think the lasting impact?
I mean, I think, my parents were amazing in that sense. They made all efforts for me to have access to the arts, knowing that I don't think they understood how, but knowing that it was good for me. I mean, I'm sure the doctors told them also, like, yeah. I mean, in fact, I go to study music because of asthma. And one of the things that music does very well is to teach you to regulate your breathing. So I learned to play clarinet mostly as an exercise to learn to breathe, because otherwise you can play clarinet if you cannot control your breath. So, instead of going to, I guess, physical therapy or occupational therapy, I'm in a music school, learning to breathe, and the teachers are teaching you to breathe and to regulate your breath so you can play that instrument in that sense. So think about that. I don't think, that some doctor told this to my parents, in that sense, and they, made it happen. So, you are, so very lucky that, first of all, I live in a town that had a music school, but also that my parents saw how that would be worth the while in that sense.
Like the universe gave you a sign in a sense, like you said, instead of physical therapy, you went to clarinet. I think, you correct me if I'm wrong. And like you don't really know how something may be a coincidence or not, and that singular little thing that helped you actually physiologically also possibly propelled you along the path you traveled to where you got now. And who knows, if that didn't happen, what effect, what direction that might have just, it's like that saying, a boat, you have to make a 1 degree turn when you're like 5 miles before like that iceberg. If we're going to talk about Titanic, if they made only a couple of degree difference at an earlier time, they would be able to avoid it. And of course, I'm not talking about catastrophic endings, but I'm like, oh, you don't know what life would have been if that little choice you made just slightly off 1 degree that could have taken you in a different direction. Who knows if you would have found this ultimately, right?
Absolutely. And, when I showed up at Brown Psychiatric Center for that interview, I was terrorized, and I'm not sure that was necessarily a secret, but I showed up in the middle of a snowstorm to do that work. And I don't know, often people see something in me that they decide to do that because I'm not sure I would have hired myself. They saw something, they offered me a job, and granted, I'm Latino, I'm a drama therapist, and what they're looking for. But I was not the only one showing up there. I was the only Latino at the time. So that put me in advantage. But they asked me, would you come in for 3 years? And I lied. I said yes. But my plan was to finish school and go back to Puerto Rico. Next thing, I'm there for 15 years, and I grew, so I was a therapist for 10 years in a psychiatric unit, then became a treatment team leader and then the director of rehab. All within that institution in 15 years. So yeah, I had to say yes to the invitation, but I also was met for someone that saw something, that wanted something on me. In theater in high school, I was sitting there being the assistant director instead of just helping. One actor disappeared and the theater teacher turns to me like, all the lines, get up there. And that's how it happened, like I wasn't planning to be on stage, to be seen by everybody of all places in high school, so there's these intersections, this offering that comes to you, but you have to grab it.
Yeah, it makes me think, like, I would love to, give even more specific advice to someone who possibly life may be given clues. Someone who's, let's say, a college student, young adult, and who potentially, maybe they love music, they love art, they like drama, but maybe they think they want to become an artist, but maybe in the back of their mind, they just don't quite realize it, that maybe creative art therapy would be, I don't say perfect, but would be something they could also be interested in. So it's like, from your experience, what road do people travel? What are the things to be mindful of that maybe you should consider creative art therapy? Maybe you want to be an artist, but here are some things for you to be mindful of. Creative art therapy as a possible field for consideration.
So the first thing I want to start is that you don't have to choose. You can be a creative art therapist and an artist. Quite a few of my colleagues have full-blown careers as artists and are creative art therapists. Some of us, are mostly creative art therapists and less of an artist. So there's an entire spectrum that people to do that. But, in a couple of weeks, I'm participating in a performance at NYU where I'm acting as part of a student project. So yeah, that means that my weekends and evenings are occupied with an art to remember lines. but it's a beautiful stretch exercise. But I also have colleagues that are professional actors and have to have complex careers that allow them to do both. Uh, Music therapists, they have bands or they are called for, to play. I'm thinking one in particular that a few philharmonics call him when they need a cellist, to sub in. So you don't have to make a choice. Many of us come into this because we are artists that feel compelled to do this work. So that's the first thing is that that we can embrace all of it at the same time. And then for people that are curious, there's a lot of places to look at. I don't know, thousands of videos in YouTube of creative art therapies. But if you want to, one of the best ways I think if people want to experience firsthand, every single organization, art therapy, music therapy, dance movement therapy, psychodrama, drama therapy, has a conference every year, and some have more than one. And it's a good investment if you want to know that's where you want to go. The amazing thing about conferences is that people are exposed to the work of many different people. So you can try different, see the work of people working very differently and figure out if this is something of your interest, and then decide, yes, I'm going to spend the time and money to go to school and become a therapist. So it's a good moment because there's a lot out there for people to explore and find out and figure out as well. And that's across the world. There's a beautiful community of drama therapists being developed of all places: Mendoza, Argentina, Santiago, Chile. Gorgeous developments happening there. But there are creative art therapies all over the world where people can find community and access, not only in terms of language, but also cool culture impacting those practices.
Okay. Now you talked about earlier about technology impacting creative art therapy, but I want to ask about the future, transition into the future. Let's say 5 to 10 years. What can possibly excite you for the near future, or what concerns you about the field?
Well, I'm mostly excited, and actually I'm doing a keynote speak next week talking about this at a creative art therapy conference. And I think the next generation have amazing opportunities within that regard. One is the research around trauma and generational trauma really have opened up possibilities. But the most beautiful thing is that we have learned that trauma is passed down from generation to generation, somehow encoded in our genes and passed from one to another. But the good news about that is that we can disrupt that there's an opportunity to stop that transmission. And I think the next generation has a great opportunity to really do the work to interrupt and disrupt that transmission of generational trauma that all of us are carrying over and over and moving on. AI, artificial intelligence, and everybody is afraid that it's going to be the end of the world. But there's a great opportunity to use AI as a tool that support people with their mental health struggles. And I'm going to be talking about a colleague of mine, friend of mine, that is training in AI to help him. He struggled with bipolar disorder and trauma. He's been training an AI tool to learn about his condition, to learn about his history, to access different techniques, and then to provide him with tools in different moments or exercises to do when he's struggling. So there's a great opportunity for creative art therapists to look at AI in a way that how it can be trained to assist our clients as they move through the world. I talked earlier about a regenerative economy. We know we need to heal this planet, and we need to change the way in we're doing this. Artists and leaders have an important role to play in roles of leadership, as we can be visionaries for not how things are, but how things could be. And art is constantly telling us what the world could be in a way. And finally, a more a little is the role of psychedelics in awakening and helping people through these processes as well. Uh, Different from other people, I'm not sure psychedelics is going to save the world, but it will help enough people to recover from trauma and other ailments in that sense. And one of the things we know with the research available with psychedelics is that intention and setting is everything in the psychedelic experience. And creative arts therapies are really well equipped to help people to integrate that experience. One of the complexities with psychedelics is that people need to make sense of the psychedelic experience, and they need guides and people to help them to integrate that experience into real life in practical ways. So I'm super excited for the next generation of creative art therapists. They have great opportunities that are opening up in right now. So in 5-10 years, this new generation of creative art therapy have a great opportunity to transform things in ways that we may not recognize ourselves.
Must be very exciting. So I guess what I found over the last few minutes, it's just, first of all, when I asked you about who comes to creative art therapy, maybe it's one of these areas. It gives you a possibility to pursue multiple passions. If it is a passion towards expression, towards artistry, you can certainly do that. You can juggle the two. Well, here it seems you can do as much therapy or performance, whatever the modality is, you can kind of make it work for you. So that's very exciting. You mentioned AI. Yes, I utilize AI to help me with a lot of backend here processes with this project. And yes, at times it feels like I am talking to a person. Like, I mean, it seems like very strange, but I'm like, wow, it could be as deep as you want it to be. As I guess if it's a very receptive tool, with a lot of very interesting potential. So I'm glad to hear that. And it seems like we touched upon on certain potentially philosophical ideas. Potentially, I mean, partially. By the way, like you mentioned generational trauma. It feels like I want to say if we ever would want to do this round 2, I would love to explore certain areas, and that would definitely be one of the things on a personal level. But I would want to talk about pain. I've come to think of personal struggles and difficult moments as catalysts for bringing out the strength that maybe we didn't even know we had inside of us. Like I've had personally my share of struggles. It's not unique. It's not like boo-hoo myself, but I also, again, this is about being honest, being vulnerable. And yes, I've had moments, well, I can only, not having a therapy session described maybe as depression, suicidal ideation, not going to hide that. But I've also realized that speaking out, giving voice again to these struggles takes away some of that heavy mental burden. And once you say something out loud, you process it differently once you get it out verbally. Mm-hmm. So I'm curious, how do you help people to get out of that place where they can see their pain as something that shapes them and maybe not necessarily something that breaks them?
Absolutely. I mean, in a personal level, I would not be who I am if that child, he had not been bullied and had to learn to survive in that environment. It shapes so much who I am. The thing is, for a very long time, I was very, very saddened by that child in me that had been bullied, hurt. I was so afraid, very, very fearful. And so through therapy, I remember one of my therapists saying, Carlos, that kid figured it out. You are here. That kid is not a victim. Otherwise you wouldn't be here talking to me. That kid somehow figured out to survive in the middle of all that. So one is, in a personal experience, sort of embracing that suffering, in recognizing that it shaped in a way who I am, and that I cannot. I think often we will think we need to get rid of that or transform it and change it. And I come to no, I need this. It serves a beautiful purpose for me to be here today and to be shaped who I am. When I think about literature And particularly, I'm thinking of the work of Bruno Bettelheim. He wrote a book about the uses of enchantment and fairy tales. One of the common things, and when we think about, musicals, Into the Woods, is that hero journey that the fairy tales and many story goes through sends the hero, usually a young person, a child, into the world, into a journey that is terrible, usually, and scary, and it is through that journey that we can come out to the other side. And that is the news of hope and encouragement. That yes, the bee, the wolf, and everything else, the giant we're gonna find in the woods, but we will find our friends, we will find our allies, and we'll find our strength and who we really are through that experience. So a lot of our work as a therapist is not to teach people to forget about the pain, but to transform the pain and to work through it. We don't want people suffering either, in that sense, although in some spiritual practices, that's sort of how enlightenment is, exists. So, but in that way, pain has a function, no? So it's to help people to work through it so you can be on the other, come up on the other side in that sense. So that human experience is very important on our development in that sense, and to know and to have that sense that we have overcome something, not by ignoring it or having someone removing it from us, but really by engaging in that journey in that sense. For some of us, that journey that is a very long journey, or we're moving from one to the next to the next. So it's gonna look very different. But we need to embrace and tolerate our human experience. And it's much more harmful when we try to simply eliminate it or be absent from it.
I love that. And you said that phrase, pain has a function. I think of this metaphor of, there's the metaphor of a sculptor and a block, and the person is a sculptor of themselves. They're carving out that block. But I would like to kind of extend sculptor of an organic block that is the human being, and to connect it to the pain. Like if you are sculpting yourself into an image who you would like to be, carving away at those little pieces is gonna hurt, but pain has a function, and through the pain you discover the strength that you have to bear the pain and become better. I think that's important for a lot of people to hear who might otherwise struggle with a self-image of themselves. They need to know that the struggle, as you said, I love that, has a function, has a purpose, and the struggle, the pain is there, going to let you know you can't go past it. A lot of the times I think, I love sports, and in sports there's that message of kind of like, you have to grind it out, you have to push yourself, you give it 110% from the standpoint as mentally you think you can do an X amount of effort, but physically your mental outlook kind of holds you back. You can probably do an X amount of effort plus 10%, or whatever that would be. But it is the pain threshold you have to get past through to move on to that next level, makes that jump. So I love that. So towards wrapping it up, what advice would you give your 20-year-old self?
Wow. I think it's just, when the door opens, step in. Just step in. The door open is for you. And I think, yes, that's the advice. Those opportunities come, and if it's not for you, the door won't open. So step in.
Okay. I love that. So Carlos, thank you so much again for joining me today and for sharing your story. I know our listeners will really appreciate your insight, your honesty, and the examples, the information you provided. I hope we infuse with this message an additional influx of creative art therapists, into the world. Before we wrap things up, where can people find you and connect with you, follow your work, and maybe possibly to continue this conversation?
Well, I'm social media. You can find me on Facebook, Carlos Rodriguez Perez. the same on LinkedIn. And my email is carlosrdt@yahoo.com. And people can reach me via email as well.
Awesome. I'll make sure to include all of that in the show notes so people can easily find you, connect with your work, and possibly continue the conversation. For everyone listening, if you enjoyed this conversation, please consider subscribing, leaving a review, sharing this episode with someone who might benefit from hearing it. Thanks again, Carlos, and to all of our listeners. Until next time, continue to push yourself.
Thank you.